Good afternoon. This is Dr. Bill White again with the American Orthodontic Society, and I'm going to kind of deal with this thing of step-down arches, and also in this particular case I'm dealing with a case that's got unusually large teeth, and so normally this comes from one side of the family, or the other side has a person with a relatively smaller facial structure, and the teeth are just extremely crowded in there. So we're going to be dealing with two problems here. Well, there are other problems too, but then two main problems. One of them is this young lady has unusually large teeth, and you can usually trace this if one parent is a different skin color or shape or kind, and they're the ones with the large teeth. The patient will have the large teeth and have the skin of the patient, of the parent, that has large teeth also. And this works out. It is real obvious between the black and the white case. And a lot of times Indians and people who have darker skin or different color skin, and if they have the big tooth, the person they marry happens to be a thin-faced, narrow-faced person, their teeth will be extremely crowded in there. And it's kind of ridiculous to go and push all the other teeth back to the back and take out the wisdom teeth or whatever it is, just to line up the others without having the mouth too full. You can put anybody's teeth in their mouth if you just expand the mouth far enough, but you come out looking, it's just not very nice looking. And so we try to make the teeth and the person's skeletal structure meet each other. And so we reduce the teeth a lot of times because of that. And in this particular case, that's what we do. So I'm going to go and we'll get into the case and go as fast as we can. It's a neat little girl here. She also has a hearing problem, and I invariably would get my hand over her ear here and it would squeal, and I would have to apologize to her for bothering that, but she was definitely had a hearing problem, and I feel for her for that reason. Now she's got a small facial structure, and when she smiles, you'll see the teeth are protruding a little bit, but not all that much. But look at the size of the teeth now. In this particular model part right here, we've got the lateral and the two centrals that fill up the whole space. You see, this is the cuspid, this is deciduous first molar and everything. So the case is very, very crowded. And I could not see the developing wisdom teeth at the time, but we went ahead and extracted, or I had somebody extracted. This was in 1974 now. I had gone into nothing but orthodontics in 1970. So I've done nothing but orthodontics since then. Once in a while might do some little something, but not hardly anything. Didn't take on any patients other than those that had temporomandibular joint problems or some type of orthodontic problem in here. And here is the case. It's slightly class 2, but not very much. And that's not the problem. It's just extremely crowded, and I'll go through her x-rays here later on in the case. So here are the upper laterals that are right behind or behind the centrals, and then there's the deciduous cuspids in that area. And here's 1974, and the lower teeth are extremely crowded here, and you can see the deciduous cuspid is missing over on this side right here. Here is the deciduous cuspid, but this is the lateral, the central, I think this is the central, and the other lateral, and this is going to be very crowded getting these teeth in this place. So we come back and take out the deciduous teeth and go under, or at least had these teeth removed for her. And then we look at this, let's see, this was 1910 of 74, so we're down the ways on the case now. This is 10 of 75. This is a year later. We have her upper teeth banded, and we have her lateral teeth that were behind have moved over in this position, and so we've got the 4 anterior teeth lined up here and banded, and the same thing done with the 4 down on the bottom. Now here we came in with this step down arch, and we've also had our bicuspids removed at this time. Now we get this step down arch just to keep from the occlusion or food hitting it up here. If you go down about the right amount, it's just about 1/8 of an inch or something like that, and you can run the arch wire down like that, come back up. And this arch wire is very useful. It has a lot of uses in it. You can expand the space in here, or you can bring the space closer together if you want to. If you expand it, I'm going to pull, I've got some artificial, just some arch wires like that, banded over here. We bent them out of regular wire, just plain wire, so I could illustrate a little bit about it. Like, if you want to expand this gap in here, then you put your upper leg right by a bracket, and then you squeeze this together and put the other one over by another bracket, and it's pushing apart like that at this time. I hope you can see this. Maybe I ought to hold it up a little higher or get back where you can see. And you will notice that the tail end of this wire, as I squeeze it together, goes up like that. Well, that makes the tooth rotate out in this direction. And now as I push on the crown, it goes with the root. And so the crown and the root expand in the same way, and they keep, they'll still be parallel. In other words, when they get the gap open, it won't just lean out like that. It leads kind of straight across. And this is just an expansion one, and you'll learn that when you squeeze one in, the center part down here goes down on the step down arch, or this part right here would go down if you were trying to open this to get a little more room, or if we start to close this space, we can close it with one of these step down arches too. And if you do that, the part that goes into your molar tube back here, you have to go up just a little bit, make a circle and come back, and then this would go in your molar tube, and you can tie that and pull back on it. So when you start to close with this type of arch wire, you'll notice the center of the wire will rise up. When you're expanding with it, it'll go down here, or it'll go up if you pull on it like that. And when you pull, it makes the tooth, see this part of the wire, the tail end of it will go down, and that makes the tooth it puts the pressure on the root of the tooth to bring it along with the crown. So this is a neat wire to learn how to work with. And you can also make this an intruding arch. In other words, you can start back here at this part of it and bend it down like that. And now when I pick it up, it pushes the teeth down, spreads them apart or pulls them together. And this is just has all kind of uses. So I want you to learn how to use this step down arch, or if you put it up above, you call it a step up arch. It works the same way, except your occlusion doesn't bother the upper wire here, but it'll bother the wire if you've got it down on the bottom arch there. The teeth above will hit this wire, and the food stuff, if it's hard, and it'll bend this part down. Where you get down like this, it doesn't bother it. And you can expand with it by making these legs go out this way, or you can contract by making them this way and then expand it over here and pull it together. So you can do both ways with it. Now let's get on with this case. This is 1 year has passed now. We started about a year ago, and I'm going to reduce that. Now this is the step down arches you can see in here, and that's while we're waiting, and you're using this during the mixed dentition. See, you're waiting on teeth to erupt into this area of the mouth, so you can run this down and just come over here, and you can either be expanding or contracted or whatever you want, or if you need some extra room, you can get it by moving these legs out like that. And we wait on the tooth to come in here before we come back and bracket and then run an arch wire across here. See, once we get them bracketed, we can run the wire in there, and that protects the deal against being bent down or bending the wire when they're chewing. All right, excuse me. All right, this is the upper arch now, and you can see this is the 6-year molar, and you'd have a second bicuspid in here and a cuspid in here and a first bicuspid in here. There's just not room in there to get those teeth, see, so we took the teeth out to start with, and you look at the parents, and if you get both parents in the room, the big teeth, and you'll have a parent with a narrow facial structure, and another parent will have the larger facial structure, and the skin of the patient you're working on will be like the skin of one of these parents with the big teeth. The ectodermal layer here, the teeth come from the same ectodermal layer that the skin comes from, and the skin of the person with the large teeth down here will be similar to the one parent that has the big teeth. And that's just almost a cinch. This is one way you can tell. So if you take a person who has got a parent with large teeth and big facial structure, they marry somebody with a thin, narrow face or something where there's much less room, and the person inherits the big tooth, and you're trying to put it in this little narrow facial structure, it is ridiculous to try to do that. You just, you either bulge the person out, or you'll have to back all these teeth up, you know, and then extract them at the back end. Just take a tooth out in the center part of it and just leave this much like it is, and you can bring this tooth up from the side. So all this rigmarole of saying it's wrong to extract, and cases like when I was having my teeth straightened, this is a long time ago, they didn't even have any brackets or anything like that. And they just believed everybody should put their teeth in their mouth and they couldn't do anything with it if they did extract one. And so they just expanded everybody. I worked out pretty good, but I had to have my wisdom teeth extracted later before they let me start the dental school, see. But some people, you're just ridiculous to try to put their teeth in their mouth. I had one referring dentist over the years that he decided at one time that he wasn't going to extract or have anything to do with extracting teeth, and they had this patient that was definitely needed extractions. One of the parents was a big tooth, and so I said, well, if you don't want to take it out, I'll go ahead and do it without it. Well, I got the teeth in the mouth, and the little girl just looked really protrusive and didn't look good at all. And I had the parents and the dentist come look at this child, and they said, well, yeah, we're wrong. Let's go ahead. And she took the teeth out, and we straightened the case up, and the little girl looked quite nice after we got through with it. Now, that's not just one case, but if you look at teeth and people that have big teeth, and one parent has the large teeth and the other one doesn't, then you've got a possibility of having a problem with it. And the tooth, the one with the big teeth, will have a skin that looks like the parent that has the large teeth. So you can write that down, and I think that's a dead cinch to be correct. Let's get on with it here now. And so we're lining the teeth up in there, and we've got room here for plenty of room now. I mean, we'll put the cuspid teeth in here, and we've got a bicuspid in this area, right in here, the cuspid in that part right there. I'm going to hurry on here and try not to take too much of your time, but you see how large those teeth are on that little girl. Now here's 1976, and we're just waiting on teeth to come in the mouth. So we started early, took the teeth out to keep them getting their mouth just too really crowded like that. So here we're going, the cuspids are coming in now right over here, and this is the second bicuspid. We took the first bicuspid out, so this cuspid will come in and take up part of this. This bicuspid will take the other, and we'll pull that into a class 1 and be missing those two upper and lower first bicuspids we took out, or recommended taking them out. Now here the cuspids have come in. We've got the second bicuspids to come in, that space there. So we'll go ahead. This is 1976, 77. I'm going to run through this pretty fast now. We've got space there. We're going to have to bring this cuspid into this gap right here, so we're holding it open. We're down to that much space. These are 6-year molars, and we see this little girl finally develops wisdom teeth, but I don't remember where we had room enough to put the wisdom teeth in. But if we extract bis, we always try to get the wisdom teeth in if they possibly have room enough on their jaw to do that. So here's the upper now that is fully erupted in there, and there's the lower with all the teeth, and that's the second molars on the bottom there. Okay, here it is. It's the midline's off a little bit. We're using a class 2 elastic here, you see, to pull this this midline is just slightly off here, and then I'll pull this back over on this side, and you can also come in and use something like that on a midline elastic, and sometimes if the other was off, you can put a class 3 elastic on that side of the mouth. You can manipulate the jaws however you want to, like that with elastics. Let's erase that. Coming on, we're the upper's holding in place real good, and the lower is lined up now good, and the second molar is in. We have them banded, and now we're going to take this out. This is 79, and she's got all the teeth in there. The midline is just about old. It's a little bit off here. There may be some discrepancy in the size of the laterals or size of the centrals. If you're interdigitated good over here on the sides, then that's fine. Just leave the midline off a little bit. That doesn't hurt. And here this is 1979, and we have the upper out and inner retainer. And 79, and here it is the night 7 of 79, and we have the lower out, and the midline still slightly off, but looks like the teeth are fitting together excellent. And now we're going to show you the little girl's facial structure after we finish, and I'll show you her x-rays. And there she's biting down all the way with that. Now here is the profile of this young lady after we extracted the teeth, and there's nothing in the world wrong with that fullness of that facial structure right there. And so these people that harp on taking out teeth being wrong and all this, they haven't really looked at the whole picture to me. They've been taught that way, and some of them don't realize it, but that's not the best way to go. You don't take out teeth very often, but you do need to remove some teeth where one parent has got a large tooth, the other one has a small face and small teeth, and the child inherits the big tooth and trying to stick it into the small structure. It is ridiculous to me. I mean, that's, I don't want to act like a smart aleck, but that really is no question about it. And so they argued back and forth for years, and finally they've come up with the idea you do need to extract some teeth, but not anything like we used to years ago in 1970, somewhere in there. They just pulling teeth right and left, didn't even look at them. Now that's a good profile there, and she's got a teeth extracted here, and the vertical height and everything looks good, and that's the good looking face. It's just the sweetest, nicest little girl you ever saw. And this is 7 of 90 of 79, and here is some other pictures. She didn't have her teeth all the way together here. I've got them apart, just showing you that. This is, all right, this is 1981. The midline is still off a little. The teeth fit underneath there good. It's 1981. And I'm going to show you the x-rays here in a minute. All right, here she is in 1974 with these crowded teeth. In other words, here's the second bite, the first bite, and the cuspid here. And here is the central, and the lateral was behind the central. If you put the lateral over here, and it came to about here, and this is your 6-year molar, and you're trying to put all of that in this gap right here, and it just doesn't go in there. Now, here again is the permanent lateral is back here. This is the cuspid coming in. running into the lateral, even though the lateral is behind the central, see. And we've got to get this lateral in place and this cuspid in place, and here's a bicuspid coming in right here. And this is the 6-year molar, and there's the 12-year molars, and she develops wisdom teeth back here. This is 74 back, and her age, I think, was 10. I'm not sure about the age on there. So let's watch this again. Now we're going to take out or send her in to get those teeth taken out. Now this is 10 of 74 when we recommended removing those teeth. So here it is 12 of 75. So this is over a year later. We've removed the teeth, and now these teeth are coming in lined up like that. And the 12-year molars are back here. Here's one wisdom tooth forming. There's another one, and I can't really tell on the bottom ones, but later on I think we'll see them come in also. Okay, here is 19, that looks like 75 from there. Yeah, maybe it is. And that's the 12-year molars are just now forming, but we have 2 upper wisdom teeth that are forming. Here it is at age, this is nearly 12 years of age now. She was 11 and 10 months, and this is 77. And here is a wisdom tooth. Here's one here, and one here. But the jaw is awful short here. So, young lady is not going to grow much past about 13. And if she grows enough, we'll put we can wait and put that wisdom tooth in there after she gets older. But if she doesn't, this would have to go. Now, it's not quite as crowded over on this side, but I think we probably lost the wisdom teeth. I don't have another x-ray later on down the line. That's the cephalometric at that point. Now, here was her facial structure when we started, and there it is after we've finished the case. When we started, when we finished. And here's the smile when we started, and here it is. The focus isn't real good there. And that's the end of the case. And I want you to look at this and really study what we did here. And I feel like that is the correct thing. It may be proven something wrong, but you've got one parent with a large teeth, and another parent comes along. Well, if they're marry somebody with a real narrow facial structure, and if the child has the teeth of the big person and the bone structure of the smaller one, they will always be crowded. And the one with the crowded teeth, the skin will look like the skin of the parent with the larger teeth. And that's just a fact. And you can check it out if you want to. If you've got a couple, with one of them's real light complected, one of them's darker complected, and it'll be that way. So thanks for watching, and join our group and subscribe to this. And we're going to try to keep you informed on as much orthodontics. This is done in 1981, I think, there. This was when we started this case. We started it here. I started it in 74, and it's been a long time keeping up, just to show you the long-term thing. in doing the case. So thanks for watching, and I'll sign off now and say goodbye, and we'll hope to see you later.